date or when?
Okay, other than that, the hotels aren't for challenging that much time, but the conference is should I turn the lights down? I'll take care of them.
Just the top switch
Yep,
here
yep.
will just kill those
Yep.
lights. Thank you so much. Perfect, thank you. Welcome, everyone. We are so glad to have you here in the room with us. And those of you who are joining us online on Zoom, we welcome you as well. For those of you that I have not had the opportunity to meet, potentially those of you online, I'm Carol Sale, and I am the President and CEO of the Williamsburg Health Foundation. Just a few housekeeping details for us to be aware of. For those of you on Zoom, we have muted your audio for the moment. So please do use the chat feature to enter any questions that you may have. I will be monitoring the chat sessions and will voice your questions for you in the room. Also, we will be doing a new technology for us. We're going to be doing some live polling as part of the Zoom meeting. So we will ask questions here in the room and get hands raised in the room, and simultaneously, assuming I get that technology right, we will be doing online polling from those of you in the Zoom link who will be giving us your feedback as well. Also, for those of you that are online, we have activated the closed caption feature of this Zoom meeting. So if you activate it on your computer, you will have the ability to read the transcription of the presentation live while it's taking place in case you happen to be in a noisy environment. For those of you in the room, please feel free to ask any questions that you may have as we proceed through the presentation this afternoon. Today's presentation is the culmination of a year-long research project that was conducted by Paulette Parker, our recently retired senior program officer from the Health Foundation, and Lily Pope, who is a public policy and health policy major at William and Mary. They were quite the duo getting this work done, I will tell you. We'd like to thank so many of you who are with us today who participated in this research by providing us with your thoughts, your hopes, and your ideas for this work. We are delighted to bring you the results of this study to you this afternoon with the anticipation that this will generate community-wide discussions and ideas for ways in which we can continue to develop the great work currently going on and to address the needs of older adults in the community. With that, I will turn the meeting over to Paulette Parker.
So great to be able to do meetings back in person, isn't it? It's wonderful to see you all and to have you here with us. And thank you so much for joining us. We have many distinguished guests with us today, both in person and online. And a lot of you are already familiar with this research, and it is also available on our website. Hang on, what's the website? Section. Thank you so much. So as Carol said, let's make this a conversation. So if you have questions as we're going along, please feel free to ask. It's very likely that you will ask things that we won't be able to answer. We certainly don't have data on all the topics that we would like to have. But we do want, I do want to, before I get going with this, want to acknowledge my colleagues, Carol and Kira and Allison and Valerie in particular. And then of course, Lily, my very talented intern who really did the legwork to pull this together. So thank you so much to all of you. Okay, here we go. So today is the summary of a longer report, which includes data and analysis on demographics, health status, aging in place supports, and the qualitative research that was informed by interviews with many of you. Thank you again for sharing your insights. And one note on the data that a lot of you are aware of is that there is not a standard threshold age for when a person is considered an older adult. So in some data sets, it's 60 years old, and in some it's 65. Those are two of the most common ones. For the report, the default that we used is age 60, but several of the data sets have a threshold of 65. And when that is the case, we will mention it. I also want to mention that the demographic data here is based on the 2019 census. And as you may be aware, we're still really waiting on the details on the 2020 census. So the Weldon Cooper Center at the University of Virginia is going to release the Virginia demographic data down to the locality level and sliced and diced in many different ways, and that will be coming out this July. So let's consider a question, a demographic question, okay? By 2030, the older adult population, 60 and up, of Greater Williamsburg will be what percentage of the total population? And those of you in the room, you can vote by raising your hand. And for people that are on Zoom, you will be seeing a polling screen. So the first possibility is 21%. How many people think we will be at 21% by 2030? No takers, okay. How many people think 27% by 2030?
We have two on the Zoom.
Good possibility. Carol, am I going too fast?
Nope, two on the Zoom, thank goodness.
Okay, and then 33% by 2030.
18 on Zoom, thank goodness.
Okay, and that is actually the correct response. We will be at 33% by 2030. Valerie. Do I need to use that mouse? So the population of Greater Williamsburg right now with the three localities is about 159,000. And the older adults make up right now about 29% of our population. For Virginia, that proportion is 22%. And the big national demographic headline is that by 2034, people age 65 and up in the US will outnumber people under the age of 18 for the first time in US history. However, we have seen that milestone come and go. Our older adult population is already 35% larger than people under the age of 18. And then this section of the report, we're going to move through fairly quickly, but the bottom line is that the older adult population is large and growing rapidly. And this is really the demographic headline for our community for at least the next 2 decades. So as a whole, we are growing rapidly. If we look backwards 2 decades, we can see that we're having faster growth in the state. Since 2000, Greater Williamsburg has grown by 28%, while the state has grown 17.5%. Now, this graph is a look forward, and you can see that the area is projected to grow to just over 200,000 by 2040. That's actually 203,000 by 2040 for the total community. And now we'll take a look forward for the older adult population. You can see the variation here between localities in all the graphs. Williamsburg is green, York is orange, James City is blue, and then the aggregated Greater Williamsburg is in red. So James City County stands out particularly here. This is the percentage of the total population by locality. And what you can see here, so here's the 33%. So that was the answer to our first polling question that we will be at by 2030. But you can see that by 2030, James City County will be at 40%. There's still numeric growth. It looks like there's a slight decline between 2030 and 2040, but in actuality, there's still numeric growth. But because of the growth of the total population, the proportion goes down a little bit. So for the health profile section, we collected and analyzed publicly available health data. And today we're going to take a look at chronic disease, disability rates, some racial disparities in access to healthcare, and the impact of COVID. So the report highlights two types of health challenges that tend to have increasing impact as people age. One is the prevalence of chronic diseases, and the second is the rate of disability. Chronic disease, as many of you know, is the #1 issue in US health and healthcare. As you can see, 70% of deaths are related to chronic disease and 90% of all healthcare spending. So for the older adult population, 80% of people age 65 and up have at least one chronic disease, and 68% have 2 or more. Chronic diseases that are more prevalent in the older adult population include dementia, which includes Alzheimer's, and also arthritis. Actually, 1 in 3 older adults dies with some form of dementia, including Alzheimer's. And we do have data that makes it possible to compare the older adult population with the non-elderly population on some common chronic diseases. And what you can see here are the comparative numbers showing that older adults are almost 3 times as likely to suffer from diabetes as their younger counterparts. And for high blood pressure and high cholesterol, they are more than twice as likely. And the obesity rate is about the same. So let's talk about the rate of disability. So here we have another question, and the question is, what percentage of older adults has at least one disability measured by difficulty in completing one or more activity of daily living? And the first possibility is 19%. We have any takers for 19%? The second option is 31%. Any takers here? The third possibility is 40%. Carol, how are we doing online?
So we have 2 people that have selected B. We have, the numbers are changing here. We have 11 people that have selected C.
40%, okay. And then the fourth possibility is 48%.
And we have 3 people that selected D.
Okay. And the actual answer here is the 40%. So. Okay. Right. So the average disability rate is higher among older adults. As we could see, it was rated to be about 40%. And what we can think about when we're looking at this factoid is the impact that this has for service providers and needed supports. Okay, this table shows some unhealthy behaviors and some risk factors. And the first column, as you can see, is people who are overweight or obese. And the figure here out of this table I want to bring to your attention is the 68% of older adults who are either overweight or obese. And the next column is people who are physically inactive. These are people who say that they have engaged in 0 recreational or leisure physical activity in the last month. So indeed, it is quite quite sedentary. And obviously that's a contributing factor for the weight issues. This is interesting because this is an illustration of racial disparities in access to healthcare. So this is Medicare, from Medicare, and it is the rate of preventable hospitalizations per 100,000 Medicaid enrollees, as you can see, by age segments and by race and by locality. This is James City County. And this means that these are hospitalizations that most likely would not have occurred if the person had been receiving appropriate preventive and maintenance care. And this is a rate. So what that means is it's actually a count against the total population. So it's in essence, it's a ratio. And this is showing, as you can see, the racial disparities here of James City County in the first two age categories. And then this is smaller numbers for the city. And again, you can see very stark disparities here between the white and black Medicare enrollees that were hospitalized for preventable reasons. And then finally, this is York County. And we can see these numbers are, well, you can compare when you look at the report. These are more similar to James City, but the notable one here is the people who are 85 and up. Before we leave the topic of health, I want to say a couple of words about the COVID pandemic, because the older adult population has been so disproportionately impacted. And this data is still pretty large scale. We really don't have a lot of state level. We have some state level and some local data, but what you can see here from the last bullet is that 85% of COVID deaths in Virginia have been adults that are age 60 and up. And between 2018 and 2020, life expectancy in the US dropped by 1.87 years, which is a pretty notable increase. This is the first time that this has happened since World War II. In the 1918 Spanish flu pandemic, American life expectancy dropped 11 years, actually, if you can believe that. Our population was quite a bit smaller, but we're closing in on 1 million fatalities right now. Today, it's about 960,000 Americans have died of COVID. And this graph is really helpful. This is actually from a British research organization that does global data. And this is based on all deaths, but the declines between 2018, which is here, and 2020, which is here, the declines are attributed to COVID. So I'm going to start by mentioning the fuchsia colored line here, which is the total US population. And you can see going back to 2010, the average US life expectancy was just below 79 years, and it moves along at pretty much that rate to here, 2018. And there's the 1.87 years that I just mentioned about the decrease. Then take a look at the orange line that's at the top. This is the American Hispanic population. And that subgroup started with the highest average life expectancy back in 2010, between 81 and 82 years, and goes along pretty much at that rate until 2018. And then we see a precipitous drop, almost 4 years, 3.88 years decrease in average life expectancy for American Hispanics. And then the turquoise line at the bottom is the American Black population. And as you can see, it starts at a significantly lower average life expectancy, just below 75 years, and goes along pretty much at that rate until 2018. And then also shows a very big drop here of 3.25 years. So this would be backed up, and I'm sure a lot of you can say the same thing, by what we know anecdotally about the community and what we were hearing during the height of the pandemic. But this is data, like I said, we don't have a more granular level of this right now, but I really wanted to show it because of the disproportionate impact on older adults. So we know that the best strategy for addressing health challenges is promoting wellness and doing prevention. And so what we're going to do now is to take a look at aging in place supports based on a good proxy, which is the social determinants of health. This is the health wheel, which a lot of you have seen. It's on the poster in the back of the room. It's on a lot of foundation materials from the Robert Wood Johnson Foundation. And the key item here is that actual health care is a relatively small proportion of what is going to impact a person's actual health status. So this is important for several reasons. Number one, this is going to be probably some of our main strategies for enhancing the quality of life of older adults. These are areas where it's most likely for us to be able to make a difference. But the other thing I want to mention here is health policy. And as healthcare reform and the ACA have taken root, what is happening now is that the public payers for healthcare, Medicaid and Medicare, as well as the private commercial insurers, are looking at how they can do more of paying for quality and not quantity. So for those reasons, the social determinants are really important, and providers that can show that they are assessing and addressing social determinants factors are becoming eligible for better reimbursement. And that is only going to continue. So national survey data shows that 90% of older adults want to age in place. Many, of course, for obvious reasons, want to avoid moving into institutional settings, but sometimes due to challenges with the activities of daily living and doing self-care, it may seem like their only choice. Lack of affordable in-home care is also often a variable here. So this is just a few more thoughts that show that addressing social determinants is key to supporting aging in place. We all want our community to be age-friendly in a way that will affirm to older adults that they're valued members of the community. And in short, what we're talking about is how to promote opportunities for engagement with as much choice and autonomy as possible. So the upcoming slides are going to be an overview of the impact of social determinants in the community. And where available, we include local data on the availability of aging in place resources and supports.
Paulette?
Yes.
Question on the chat.
Sure.
This comes from Nancy Sullivan
Okay.
and with Williamsburg Community Foundation. She's asking, how much effect will changes in lifestyle have for older adults?
That is a great question. And what we are often talking about is delaying the progression of aging, delaying the progression of chronic diseases, and reducing the impact that chronic disease and disability might be having on a person. So lifestyle changes are extremely critical in maintaining quality of life for as long as possible for older adults. Great question. So I was just saying, we're available. We're going to include some local data. And there's a number of maps in this section of the report. And what this one shows is the geographic distribution of households with at least one older adult. And the household income, not the per capita income, is 200% of the federal poverty level or less. And the reason I have this in today's presentation is because 200% is such a common criterion for public assistance programs. So in the report, there's also this same map that shows people that are actually under 100% of the federal poverty level. So just to give the what the criterion actually is here. For a household of one, this would be income less than $25,700, and for a household of two, it would be income less than $34,800. And I'm not going to get too into what's where. We all know that our locality and our census tract boundaries are pretty crazy around here. But just to mention a couple of things, the very low number, the 49, that would be Camp Perry and the Naval Weapons Station area. That's why that is showing so low. And then up there along the north area of York County, you can see the Lackey area, and then Grove area of James City County. And then in the upper county areas, you can also see some fairly high density here for households that have at least one older adult that are 200% of the federal poverty level or less. This table shows the number and proportion of older adults that are below 200% of the federal poverty level. And if you add up those households in Greater Williamsburg, that is almost 4,400 households. And of course, employment is a significant factor in household finances. And it can be an important element of financial security, although it might not be sufficient to maintain a household. So this is 2019 data, and it's pre-pandemic. So keep in mind that one impact of the pandemic has been people leaving the workforce. And in many cases, it was people leaving the workforce when they didn't want to leave the workforce. And in that situation, for older adults, it's sometimes been very difficult for people to return to the workforce. And I mentioned earlier that we did key informant interviews, but several of our key informants are in the room with us today and on Zoom. So we're including some of their quotes, and there's a lot more of the key informant observations in the paper. And these are some of the quotes that we heard around housing and security. The report includes a number of other data points, including the number of older adult households that are, quote, cost burdened. In other words, they're spending more than 30% of their monthly income on their housing costs. So as we all know, both rents and median housing values in our area are very high. This is households with older adults that are living alone by locality. And you can see here the percentage of households with an older adult living alone, the households, the count on those households, and then the total households that is a percentage of. One thing I think we're all aware of is that living alone is not an indicator of successfully aging in place. On the contrary, an abundance of research shows that living alone as an older adult is a marker for numerous risk factors, including, of course, social isolation, physical problems, depression, and even decreased life expectancy. So if we tally up these households, what we see is that over 20% of all of our older adults in greater, that's not in the table, but over 20% of all of our older adults in greater Williamsburg live alone, and they make up over 10% of all of our households. So speaking of people living alone with health risks, we know that one of the increased risks on living alone is depression. And there's a section in the report on behavioral health. We've got this question before us now. What percentage of older adults with depression or another behavioral health disorder does not receive treatment or services? We have three possible answers, and the first one is 65%. Anybody say 65%?
I've got 6 people on Zoom who say.
Okay, 65%. The second possibility is 51%.
10 people on Zoom think it's B.
Okay, and the third is 36%. And sadly, the answer is 65%. So there's, there are numerous reasons for that, which, I won't, try to go into today, but only about 35% actually receive diagnosis and treatment. Sorry. Which way I need to do? Just click once. Okay. Okay, so this is the geographic distribution of households with older adults living alone by census tract. And again, you can see here similar patterns. When you look at the maps side by side, you can see the household finances, transportation, living alone, use of public assistance programs, they all correlate quite closely with each other. So this is the geographic distribution of people living alone by the various census tracts. And we are able on this data to drill down by gender. And when we do that, what we see is that those households are very heavily skewed toward females. And you can see for each locality here, we have the city of Williamsburg on the top, and then York County, and then James City County. And so by far the majority of older adult households with people living alone are females. So caregiving is a very important aging in place support, and has really bearing on every aspect of quality of life. And it's critical for households of all sizes, as well as people who are living alone. So we've got a question, and that is, what is the estimated value of care provided free by family and friends in Virginia each year? And 4 possible answers. And the first one is $11.8 billion. And do we have any takers for the big number at the top, 11.8 billion?
We have 5 people on Zoom.
Okay. The next option is $5.6 billion.
We have 8 people on Zoom.
Okay. And the third option is 2.3 billion.
2 people on Zoom.
Okay. And the fourth option is 890 billion.
2 people on Zoom.
Okay.
And actually the 2.3 billion is now jumped up to 4 people on Zoom.
Okay. And the correct answer is A, $11.8 billion value of care provided free in Virginia every year. The AARP says that 1 in 5 Virginians is doing some level of caregiving. And probably many of you are caregivers part-time or know somebody who is. Okay, transportation. Talking about people living alone, I wanted to put this topic right next to that because obviously they're interrelated. And this is showing comments that were made about transportation challenges. We're all aware that transportation is an issue in the community, and older adults are particularly at risk for transportation challenges. These are some of the very good comments and quotes that we had from our key informants. Now, we are not able to segment this data by age, but I wanted to put it in because this shows the households with no vehicle by census tract. So some of these are older adult households, but I just wanted to put that up because we all know the community well enough to know how isolated a person is if they're in a household with no means, with no vehicle for transportation. So when we asked our key informants, what is your main concern about the community right now? The most frequently mentioned thing was social isolation. And a couple of informants pointed out some of the numerous benefits of socialization, including cognitive function and the fact that socialization can prevent or slow dementia. And let me mention that the report includes additional data and findings on other topics around public supports and use of public assistance programs, including SNAP benefits and SSI, because we're going to transition here and have a question. This is a true false question. And the statement is older adults with more social ties and engagement are found to live longer, have better health, and be less depressed. How many people think that's true? I think we have unanimity.
Online as well, 100% said true.
So important point for us to consider. Okay, so hearing from the community, the list of questions that we asked of the key informant, Kara and Lily and I did the interviews together. And the list of questions that we asked and the list of key informants is in the report in the appendices. So by doing the interviews, we wanted to round out the research with qualitative input from leaders working in the field. And as we hoped, the qualitative research correlates closely with the quantitative findings. So in addition to social isolation, housing, transportation were also additional areas of concern. And you can see some items up here too, food security and nutrition. We asked providers of services what they would do if there were no constraints on costs or resources. And again, responses were around home care, transportation, housing, and also person-centered dementia care. So in the literature and in our research, including the key informants, we see an emphasis on how to support autonomy and dignity. And we know that an age-friendly community is one that supports older adults having choices and remaining engaged, but still being as independent as possible. As you know, the purposes of this report are to inform and facilitate community dialogue among providers of services and decision makers, and to serve as a catalyst for collaborative approaches. And we hope that you as community leaders find these findings both affirming and empowering. And I just want to once again thank you for taking your time to join us today. We don't take that lightly. And to also say even more so, thank you for what you do every day. Because for all of you that are here with us, your commitment to our older adult community is very evident and is obviously having a positive impact on the lives of our vulnerable older adults. And I'm just going to progress one more slide up here. So as you know, this is a report that the report is quite lengthy. It has a detailed table of contents so that you can quickly find what you're looking for. And in the bibliography, everything has a live link to the data. And back on the table by the door, I have hard copies of the executive summary and the table of contents. So we're hoping that the report will remain relevant for several years to come because it is so easy to update the data that we have in the report. Are there any other questions that I might be able to speak to?
Why don't we unmute people, Valerie, can you unmute people online, see if they have questions online? Also, I wanted to sort of take advantage of some of our experts that we have in the room. I'm looking at Ellie and Christy and Diana, and I was thinking about Nancy Sullivan's question earlier about, what effect does lifestyle changes have on older adults? And I wondered if the three of you or any of you may have any thoughts on that, stories that you've seen, challenges that you've seen people face.
social determinant of health, but I think it ties in with what we've already seen about the importance of isolation and helping people have that social connection.
I think too, just segueing into what Christy was saying, when you were focusing on the tools and the identified needs that our community is lacking when it comes to non-medical transportation, there's so many people in our community that would probably love to have some type of opportunity like a volunteer service, but lacking that transportation to and from, they may be mobile and they may be able to walk and to actually physically volunteer somewhere, but the lack of the transportation to get them somewhere to be able to socialize, I mean, that just that's huge, and such a factor like that would promote longer lifespan and just promote overall wellness. So it's thinking about the terms of I think the data speaks for itself, but then what can we do with that? What can we find and provide support in our community so we can overcome such negative, the things that are happening in our community. So
Yeah, I think one of the things that we've noticed is not only the impact of COVID on social isolation, but also the impact that it's had on people's physical abilities. So while we've gone in to visit people after not having been into their homes for a couple of years, the physical decline, much of it caused by the social isolation, has just been amazing. And it's just been just sort of something that really surprised us, just to see that.
Paula, just to clarify, the obese or overweight is a BMI greater than 26.
Paulette?
I'm sorry.
Is overweight or obese BMI? Is that defined as a BMI over 26?
Yes, overweight is above the range for your height in your age. And obese is a BMI of, what is it?
30, I
30
think.
and above, I believe, or more than 20% above your target range.
And I wanted to mention, I have a friend with a mother in her 90s that lives in San Diego, I believe. And she does have some memory loss, short-term memory loss. But there, they have retired firefighters, EMS, and police who check every day on elderly people living alone, every weekday. And they spend no more than 15 minutes. And he jokes, he says he was talking to one and they said, does my mother talk to you? She says, oh, we don't have any problem with your mother talking to us. It's fine. We always have to tell her we have to leave. It's 15 minutes.
Yeah. And Vince, you can speak to that too. I mean, there are numerous strategies for trying to keep up connections with people, and people became very creative during the pandemic. Obviously, internet access can be an issue with the older adult population, but where that has been available and has often been utilized, including by people in this room, and also just telephone contact as well can be effective. Carol, I think I'm gonna hand.
Well, could I make a comment?
Oh, sure.
Just in response to Christie's comment about being sedentary, a little like a decade, maybe 11 years ago, we funded a study fielded by the Older Dominion Partnership to oversample here, and the results of that indicated, compared to older adults in the rest of the state, our older adults really liked to go to movies and restaurants compared to, a walking trail or other forms of exercise. So we can sort of check the movie and dinner in a movie box, but I think that is in line with the sedentary piece.
I was hesitant to quote from the older, what was it called, the ODP, older
Dominion
Partnership. Christie and
older
you and I
Dominion.
were all on the group for that, because it is a little bit, the data is a little bit older.
Yes.
But when we asked people, what is the number one factor affecting their quality of life, we gave like 5 choices. They said that the health was the number one factor. And the other piece of data that came out of that report that was really interesting was income strata. And we asked people what their household income was. And, one of the myths about Greater Williamsburg is that all of the older adults here are affluent, and that's obviously not the case. And the data there showed that 31% of older adults live in a household with an income of $39,000 a year or less. And you can see it here in this report too, that the 200% poverty. So Carol, I'm going to hand to you. Thank you
So much, Paula. So as you saw, the research began with perspectives from so many of you in this room and joining us on Zoom. So we know that some of these findings are no surprise to you. For some, you already know someone, a neighbor or someone else who lives alone, whose children are out of the area and are trying to manage their own children. You see it, if not live it every day, and the reality of this. But it's important as a community that we do take stock of the situation so that we might engage a wider audience and support for the challenges and the opportunities that exist for older adults in Greater Williamsburg. Knowing the current status of the community and what the data reveals helps us to plan a more effective future course. We will all benefit from keeping our older adults engaged, as we know they possess a wealth of experience, wisdom, and in many cases are deeply committed to serving our community. At the same time, supporting our older adults as they age in place will call for creative approaches to optimizing and enhancing a broad range of services and resources. The foundation does not have all the answers or the resources, and as always, seeks community partnerships to work with us to address these challenges. What we need as a community is to tap into the time, talent, and treasure that is the sum of what everyone in our community can do to help make ours a more age-friendly place to live. What we need from those of you in this room and on Zoom are your visions and insights, your best practices, and your lessons learned. How can we create more powerful partnerships that support our elders? How can technology help us make our more age-friendly community? We want to hear your ideas and to learn with you. Thank you so much for coming today, for assisting with this research, and for all that you do every day. And we hope you will be working with us in the future on these issues. Thank you so much for coming, and I hope you have a great afternoon. Thank you also to those of you online. We really appreciate your joining us through this technology. Thank you.
Thank you.